Okay, first of all, good morning. I want to thank you all for joining me today. Let me introduce first the people who are standing with me today. We have our Commissioner of Health, Dr. Patricia Ruppert, our County Attorney, Thomas Humbach. We have Dr. Mary G. Marsico, the BOCES Chief Operating Officer. We have representatives from Senator Carlucci and Assemblywoman Jaffe's office here, and also my friend Ken Zabrowski, Assemblyman from this district. In case anyone has forgotten, 122 days ago, I stood in the same room with health officials, business leaders, and law enforcement, and many of you, to declare a state of emergency here in Rockland County. Much of what we predicted in March has come to pass. Increasing cases of measles, continued public exposures, and worst of all, uncertainty and fear in our community. On that day in March, we had 153 confirmed cases of measles. Today, we have 283. The number of cases per month has decreased by 29% in May, 63% in June, and 42% to date this month of July. But we have also seen the people of Rockland step up to help protect themselves and their neighbors. After a 13% increase in confirmed cases between March and April, as you can see, we've seen a steady decline since then. In short, to Rockland County, congratulations. We assured all back then when things looked very bleak, when we were the hardest hit area in the United States, with 30% of the cases nationwide, that we would beat this outbreak, and we have. While our cases have decreased dramatically, we have continued to watch our MMR vaccination numbers climb. 25,876 vaccinations have been given since last October. That's a 52.5% increase since our original declaration. For those who are a bit math challenged like I am, that is 8,918 more. And to compare that 9-month figure to what the normal annual numbers are, we typically give out about 1,200 MMRs per year. We have been maximizing vaccinations while minimizing exposures. That has been the prime mission of this effort under the auspices of our health department. And I want to offer kudos to our health department for all of their hard work. Since our original declaration was made in March, the Department of Health has increased their capacity to identify, locate, and monitor residents exposed to measles. If someone is known to be exposed to a measles case and their immunization coverage is either unknown or inadequate, they are placed in self-isolation and followed up with daily phone calls for symptoms checks during the entire incubation period. Over the last 4 months, a range of 60 to 140 people have been contacted each and every day by the Department of Health and the expanded staff for the New York State Department of Health and the Center for Disease Control, all stationed in Pomona. This regular monitoring of those known to be most at risk is likely a direct influence on the downward trend of cases we have seen each of the past 3 months. Most have not seen the behind-the-scenes work that has provided the foundation for this success. I can tell you, as a former police commander, the only thing I can say about this effort is that it's similar to some of the large-scale investigations I saw in major emergency incidents in New York City and in Baltimore. Despite the state of emergency ending, these orders will still be issued to those exposed to measles. We will not stop until we can again say that measles has been eliminated, and know that this time the disease will not return. I want to take a moment right now to introduce Dr. Patricia Ruppert, our Commissioner of Health. Doctor?
Thank you, Mr. Dang. Good morning, everyone. The efforts of my team at the Rockland County Department of Health, along with our colleagues at the New York State Department of Health and the Centers for Disease Control, have been on site assisting us in Rockland, and their efforts have been nothing less than extraordinary. Through the Commissioner's orders that I have issued since April of this year, we have gained excellent compliance. The message is sinking in that everyone needs to cooperate for the good of public health. My orders to summer camps are also being fully complied with, ensuring the safety of thousands of students attending camp here in Rockland. To date, over 19,000 immunization records have been reviewed by the remarkable camp team that we have. And that's comprised of staff from my department, the New York State Department of Health, the CDC, and our neighbors from the Westchester Department of Health. They have all worked effortlessly and seamlessly to review 100% of the records for campers and for staff prior to issuance of permits for the camps to operate. Please note, all of the camps were permitted on time. They all opened on time. They were permitted without delay because of the work of this entire group. This was an amazing accomplishment for the protection of public health in our county, with 283 cases, the most outside New York City. And that is what all of my orders have sought to do, to protect the public health of our residents, particularly children who had been most hit during this measles outbreak. So I continue to encourage anyone who is not vaccinated or unsure of their vaccination status to get vaccinated or have their titers checked. Being up to date with your measles vaccination is the best way to help to protect you, your family, and the community, especially those who cannot get the MMR vaccine because of specific health vaccinations or very young age. We continue to offer walk-in hours at the Department of Health at 50 Sanatorium Road in Pomona. It's a second-floor clinic, and the following dates and times in rest of July and in August will be Mondays and Tuesdays, 2 to 4 p.m., Wednesday through Friday, 9 to 11:30 in the morning. And anyone that needs an evening appointment, we can accommodate them as well by calling 845-364-2543 during our regular hours. So in the past 3 weeks alone, in July, we've administered 191 MMR vaccinations during these clinic walk-in hours. And I thank all of our residents who have been vaccinated during this outbreak, and once again want to reiterate the importance of vaccination to those who are uncertain. Vaccines are safe, vaccines are effective, and they are the only way to prevent measles and many other dangerous diseases. So I want to thank our local representatives and the sponsors of the bill who eliminated the non-medical exemptions. Ending all non-medical exemptions to vaccination will lead to significantly improve the health outcomes for those who live in New York State. So thank you. So for the past, it's almost 10 months now, right, that I've been leading this outbreak, and we've been dealing with this. It's the longest, as you know, since measles was eliminated in the year 2000. I've witnessed the effects of the measles outbreak on a community, including multiple hospitalizations, including ICU admissions, and even a preterm birth that was caused by a mom who had the measles. Remember, this is a vaccine-preventable disease. I must remind you that although this outbreak has shown great signs of improvement, it is not over. The United States recorded 25 new measles cases just last week, bringing the total for the year to 1,148, as our country has recorded its worst measles outbreak since 1992. And these 25 new cases represent a rise of 2.2% from the previous week in 30 states of the United States. So my message remains clear. If you have the measles or have been exposed, remain isolated as per public health requirements. Those people know who they are. We contact them in person. If we contact you as part of our contact investigation to work up a case of the measles, please cooperate fully. You don't want a subpoena from me. And if you're not immune and you can receive the MMR, please do get it. It's safe and it's effective, it's available, and we're happy to provide it for you. Thank you.
Thank you very much, Dr. Ruppert. Again, echo Dr. Ruppert's comments. I do need to credit our local state delegation, Senator Skoufis, Senator Carlucci, Assembly members Zabrowski, Jaffe, and Schmidt, who worked and voted for this legislation that eliminated all non-medical exemptions to vaccination. This law will lead to substantial increase in vaccination rates. We saw that in California already, and to the improved protection of most of our vulnerable residents, infants, immunocompromised, and those who have legitimate medical issues, as was mentioned by Dr. Ruppert. With Rockland being at the epicenter of the measles outbreak, we greatly appreciate that our advocacy and local efforts were heard and acknowledged in Albany. We are showing what government can do when local, state, and even the federal government can work together. Health and Human Services contacted my office to follow up on a letter that was sent to the President requesting the federal government intervene in checking the immunization status of people entering our country, It is illogical that we, as Americans, are asked to get inoculations when we leave this country, and people can come to this country without showing any sense of immunizations or immunity to diseases such as measles. It is illogical, and we're hopeful the federal government acts. As you can hear, 30 states already have been infected. As you may remember, this outbreak began when 7 unvaccinated travelers entered the United States, came to Rockland, and all settled in one small community in Rockland County. It basically created a petri dish. That was the issue. This was the longest outbreak in the U.S. due to measles, as was mentioned earlier, since it was eliminated in 2000. Regardless of these challenges, the Department of Health, the State Department of Health, and the Center for Disease Control have risen to meet them. So has our state legislators, and today on behalf of the people of Rockland, I want to publicly thank each and every one of them for their Herculean efforts. We continue to focus on the future, and as we approach the start of school this fall. A primary concern, a recent New York State Health Foundation report shows that there is much work to be done across New York before school resumes. In Rockland, during the 2017-2018 year, out of the 69,894 total enrolled students, there were 1,663 with religious exemptions. Now, while that is only 2.37% of the students, we found during the course of this outbreak that many students were both unvaccinated and did not have a legal vaccination exemption. That is unacceptable, and it will not be countenanced here in Rockland County. Across New York State, excluding New York City, during the school year, 26,217 students in public and private schools and preschool programs statewide had documented religious exemptions from required vaccinations. I have the opportunity here to introduce Dr. Mary Jean Marsico, who is the COO of Rockland BOCES, to speak to some of the efforts that had been worked on collaboratively with county government with the coming of the school year in September. Doctor?
Well, first I want to thank County Executive and Dr. Ruppert for the efforts that they've put forth on behalf of the children and families in Rockland County. As the Chief Operating Officer, I have a responsibility here to represent all of the school districts in Rockland County. And as such, I'm happy to say that since we started this initiative, the public schools are really ranking in the high 90% compliance rate with the immunization, particularly as it relates to the religious exemptions. At Rockland BOCES, we had to jump very fast because we run a very large summer school program. So when the legislation was passed, we really needed to get the message out to families that were sending their children to our school-based programs to let them know that children had to demonstrate immunizations. I think we've had conference calls with Ed's office. We've had conference calls with Dr. Ruppert to really spell out to the school executives, who then in turn worked with the health coordinators and the nurses in all the public schools across the county to make sure we're getting the right documentation. We're making sure in those areas, particularly where we have children with compromised immune systems like we do at Rockland BOCES, particularly in Jesse Kaplan School, to ensure that we really are double-checking the immunizations, because the risk to our children that are medically frail is very significant. We found that our families came to the table. They did what they had to do across all the public schools. Many of the public schools are still working on it, although when I spoke the other day to them, we're really probably about 98% compliance at this point. As being an educator for over 30 years, I am very much aware of the urgency of this matter and how important it is that we ensure safe, healthy learning environments for our children and for our families. School is a place where you send your child to be safe, to learn, and to have a healthy experience. So the initiative by our government, by our county, obviously by our Department of Health, has been nothing other than remarkable. I feel honored to be part of this. I do have to point out Dr. Ruppert's yeoman lift on this. I also am on the Board of Health, so I have to say that I'm very proud of the efforts of the department. On behalf of the school superintendents in Rockland County, I want to thank everybody, but I also want to commit that we as school superintendents are committed to ensuring that every single child is immunized with all necessary immunizations. So I thank you, and I appreciate the efforts.
Thank you. Okay, to reiterate, while the state of emergency is no longer in effect and the outbreak is waned and under control, Our vigilance will not be compromised or slowed in any way. We will keep our foot in the pedal and our eyes on the road ahead. With the authority of the Health Commissioner's orders, which will be continuing, and the new legislation allowing for medical exemptions only for school entry vaccinations, we will be inspecting all schools to ensure strict compliance. Let me be very direct and very clear. We will not allow this disease to again take root in our county, whether it be due to administrative failures, an attitude that the law does not apply to all, or some misguided sense that the world revolves around you, to the direct detriment of all. We will back up this compliance effort with fines in the tens of thousands of dollars and court action as necessary. In closing, to the people of Rockland County who have endured this now for about 9 months, we will not let up on any front until we can say what we said 19 years ago, that measles has been eliminated. We will grant no quarter to anyone who by action, deed, obstinance, or apathy looks to put the health of our county at risk once again. But with that, we will entertain questions from anybody. Yes, Sarah.
When will the county feel comfortable declaring that the outbreak here has ended? What signs or indications the outbreak is over?
Right now, I would characterize this as we're going to have sporadic cases potentially here and there, relatively minor. The outbreak, as we have been experiencing it, frankly, is over right now. So I think it's a matter of the words we're going to use here at this point. But I want to reassure the people of Rockland County that Rockland County, even now, for 2 years in a row, has been designated as the healthiest state in the state of New York. The healthiest county in the state of New York. So we will continue doing that. This is how, through Dr. Ruppert's vision, when I first came into office in 2014, of bringing services out to the people, we were able to immediately pivot and react to this outbreak initially. And it's through that effort we will continue, and we're going to continue to do what we're doing. But I just want the people of Rockland to know that the crisis that we had is over. We are remaining vigilant to deal with any sporadic cases of measles that might come up. I think it was a very important point that was made by Dr. Ruppert was twofold. Measles is not a joke. It's not fever with a rash. And we would like to see the people who are older, people who have not given this a thought, to get themselves checked and make sure they are in fact immune. Most of the cases we had to deal with, about 85% of them at one point, were under the age of 18. We had very few adults. We still have a couple adults here and there who have been infected. So if you're not sure, the public health point of this is to go get your titers checked. Make sure you have a comfort level. Together we are getting this done, and together we will get it done. Yes?
Since the commissioner's orders were issued when it comes to the isolation orders, no one has been fined, everyone has complied, is that fair to say?
Sure, I can answer to that. So no one has been fined, and we have had 100% compliance to the orders. If I can just add on to Mr. Day's remarks, just to clarify for you, Sarah, that as far as a crisis is concerned, and Mr. Day is well said it, that the crisis part of this seems to be over, and we're very, very grateful for that. For the outbreak, though, it will not be considered completely over until we go through 2 incubation periods, and each incubation period is 21 days. So we will not be comfortable saying that the entire outbreak is over until we go through 2 incubation periods. Okay? But as far as the crisis, absolutely, we've passed that.
21 days with no new cases.
21 times 2.
42.
2 incubation periods. And remember, part of that is because many of the cases have not been reported to us, and we find out about them later. And then we have to do the investigation, and then we add cases on, including just yesterday, we added another case on.
With school starting in like 6 weeks, when do schools have to start reporting their vaccination rates, or how's that going to work to ensure that everyone's compliant with the new state laws?
So for those schools that are starting new enrollments, they have 14 days from when the students enroll in order to have them become in compliance, which is to receive the first set of vaccinations. And again, this is not just the MMR at this point, though that's one of them. And then have the appropriate dating appointments for the follow-up immunizations per schedule.
And you guys are tracking all of the former religious exemptions to make sure that they are in compliance or not attending school?
Everything is being tracked and evaluated.
Is there any way of knowing out of the 1,600 some students who have religious exemptions, how many have been vaccinated as of now?
I don't have those numbers now, they're still being evaluated.
Just want to know, since it's summertime still and people are sharing pools, is that heighten the risk of communication? Or, do the public pools have any safety measures?
So measles is not transmitted through water.
Okay.
It's transmitted through the air, so it would really be in wherever you are that you would have a respiratory contact or a contact to a surface where someone has been, and that could be anywhere. But there's nothing specific
Sure.
for
Does it have to be
pools or
closed
water.
space, or is it open spaces as well?
Measles finds people who are not immune.
Okay.
So in this room, or even in a larger room, if you had someone who had the measles an hour and a half ago, less than 2 hours ago, you could pick up the measles if you're not immune. And usually about 90% of people in that circumstance do come down with the measles.
Is there any concern that the reason that the cases have dwindled is because it is summer and a lot of people are, gone? And then when school starts again, it'll, flare up again?
There is a seasonality to measles, but we're hoping that with the quarantine measures that have been put forth, as well as the increase in immunization to the community at large, that we have, turned the corner and made a difference, and we're hoping not to see anything further in September when everyone comes back to school. And by the way, the reason that I made sure that we had 100% evaluation of the documents for all campers and staff was just for that reason, so that this summer we wouldn't have an issue, we hope, in the camps. We did the most we could to make sure everyone is immune.
Sorry, my last question, I promise. Westchester County is considering legislation to potentially give the health commissioner or the Department of Health more power if there is another potential outbreak like this. Is Rockland County considering any similar?
I think I have what I need. I don't know, Mr. Beck, what you want to.
To be honest, I can't answer for the county legislature, but the reality is that the commissioner has done everything that she could possibly do, and we haven't run into any situation where her orders were being said that she's overstepping her bounds. I don't know what legislation they're looking at doing. They may be looking to maybe provide some more comfort within the letter of their law in Westchester, but I would suggest if you ask them, I don't know specifically what they're trying to accomplish, because we've accomplished what we've accomplished here with the existing law. Pick one.
This might be for Tom,
Okay.
but just an update on the American Camp Association's lawsuit?
Yeah. Good, Tom.
The county attorney's office actually settled and closed the American Camp Association lawsuit. To be brief about it, their primary concern was having their lists of campers, the identities of the children, and their contact information released. We have assured them of the confidentiality of the information, and we have given some assurances in terms of checks and balances that they'd be notified if there was some kind of legal request for that information, so that they could step in and put their own efforts towards stopping that request if necessary. So, and that's the totality of the terms.
I was going to ask the same thing.
Any other questions, concerns, thoughts?
Thank you.
That's it.
Congratulations.
Okay, thank you very much, and congratulations. And I can't really emphasize this enough, the due credit for the work that's been done here. I may be the county executive, but we have tremendous people working here in county government, and led up by Dr. Ruppert, and the tremendous help we got from the state, Westchester County. It is just a remarkable thing to see, not only all levels of government, but different areas of responsibility, just moving forward to do the right thing. And it's just really, it's a wonderful experience. It really is. Yes, one more question.
Yeah, how much did this cost the county, the outbreak itself? We
Oh,
wanna know?
Yeah, as you do want, well, people should know. We've gone through a lot here to get something done that had been done on as a matter of routine, and we ran into a number of obstacles from some folks who just don't get it. Listening to the anti-vaxxers, I'm going to editorialize here. Listen to the anti-vaxxers who are telling us that the reason why measles is spreading is because we're giving out MMR vaccinations. This is the logic we're dealing with. All right, the fact of the matter is, that's what is stopping it, along with the great effort being done, the investigative work being done, by the Commissioner of Health and the people who are assisting. But the New York State Association of County Health Officials have looked at Rockland County's efforts, and their estimate range for the cost of this outbreak ranges from a low number of $2,196,000 $268 to a potential maximum number of just under $6 million, $5.9 million. We are working very diligently to gain extra funding. We've had the state help us out, and I appreciate the effort from our state representatives to find other areas of revenue. We are looking not to have this hurt us fiscally. This is one of the reasons why we're very careful about how we spend money here in Rockland County, because we almost went under once, and all it takes is something similar to this to put us back on our heels, and this is why we're careful. So we're making every effort to do what we can do, and just so people have a sense of what $6 million is, $6 million is the equivalent to about a 6% county property tax increase. Don't get worried, folks, we're not looking to do that. But we are working very hard and diligently to ensure that we moderate the impact of this on our budget. I'm sorry?
Did you have a specific place to get the vaccination?
Oh, you had.
Sure. Every day of the week, Monday through Friday, those in the community in Rockland can come to the health department. We have Monday and Tuesdays in the afternoon, 2 to 4, Wednesday, Thursday, Friday, 9 to 11:30, and we accommodate also in the evening as people need to.
The main number.
The main number is 845-364-2534. Okay, thank you.
Anybody else? Okay, again, thank you very much for coming here today. Appreciate it.
And thank you for all you've done all along in these almost 10 months, because I think you coming, attending, getting the word out, asking the right questions really has helped us, so thank you.
Agreed. Thank you very much.